Hello, everyone. I'm Dr. Spence Pentland, Clinical Director of YINSTILL Reproductive Wellness. Welcome to my presentation on how acupuncture improves fertility treatment success rates and patient experience. So, obviously, in our clinic, we get asked about these things all the time. So, this is going to quickly go over an overview of how acupuncture influences reproductive health, and then we'll dive a little bit deeper on a review of the most current quality research on acupuncture and how it impacts IVF and other fertility treatments, as well as its positive impact on patient experience going through these reproductive medical interventions. So, to start with, an overview of acupuncture mechanisms influencing reproductive health. So, acupuncture is understood to affect several mechanisms associated with reproduction. So the first one would be that acupuncture is thought to induce neurotransmitter secretion, chemicals in our brain that activate the release of gonadotropic releasing hormones like FSH and LH. You may have had a test for FSH to check on your ovaries, or you may pee on a stick to check your ovulation and LH hormone. And when acupuncture helps with this release, it helps increase ovulation and promote regularity to the menstrual cycle and overall fertility. Acupuncture is also thought to inhibit central sympathetic nerve activity, so the part of our nervous system that regulates fight, flight, or freeze, which most of us are likely within a lot of our life due to stress. And in turn, acupuncture then thereby increases parasympathetic activity, which is more feed and breed. So fight or flight, more resources in our body are directed to heart, lungs, brain, big muscles. Parasympathetic, or the feed and breed, resources get sent to our digestive and reproductive system. So this results in increased blood circulation to uterine and ovarian tissue, as well as the testes and sperm from a male factor. So that's the really important piece there, the increased blood circulation, in particular when we're putting in good nutrition and taking care of ourselves. And finally, acupuncture is understood through its effects on increasing endogenous opioid production, or beta endorphins, which are our feel-good or pain-relieving chemicals. It appears to downregulate various stress responses. So these are known, stress is known to inhibit fertility, particularly ovulatory hormones. And in doing so, acupuncture also plays a role in regulating cytokine activity or inflammation, which is known to impact implantation and early loss. So moving on to our deeper dive into a review of the most current quality research on acupuncture used in conjunction with common fertility treatments. I encourage you to listen, even if this isn't research isn't an interest of yours. It's important to understand that in the scientific literature, acupuncture is being shown to help increase, in particular, live birth rates when used in conjunction with fertility treatments. So I'm going to move into just really quickly main issues that arise with acupuncture and IVF research. Despite the issues I outline, acupuncture and Chinese medicine are proving to be very beneficial in optimizing people's chances of IVF success, and should be considered as adjunctive therapy to those undergoing any assisted reproductive technology or medications. As research in this area improves by addressing the following issues, I'm certain we'll see even more positive results. So, strict non-individualized protocols. So this flies in the face of natural medicine like traditional Chinese medicine, acupuncture, or even naturopathic medicine. We individualize to our patients. But a major issue with some of these studies is that never before tested acupuncture protocols are used. And then rather than stating these findings don't support the use of this type of acupuncture protocol in the improvement of IVF outcomes, they generalize their findings in the conclusion as if it applied to all acupuncture protocols. So a colleague and researcher, Brandon Horn, put it best when he states, This is somewhat analogous to conducting a clinical trial on the efficacy of pharmaceuticals against Staphylococcus aureus. So that would be a bacteria, using acyclovir, which is an antiviral, as the pharmaceutical, and then stating that all pharmaceuticals are ineffective at treating bacterial infections. So there's indeed acupuncture protocols that were found in clinical trials to improve IVF outcomes. So there's also other protocols that were found to have no effect, and one actually to negatively impact. So it's also why it's important to seek out people who are qualified to treat reproductive health issues, and get referrals to people that you can trust. Number 2, so inappropriate and unverified controls or sham. You always have to control against a placebo in research. So many studies done to date on the topic of acupuncture and IVF involve inappropriate or unvalidated controls or sham treatments. So in scientific research, there's a control or a sham arm of the study that needs to be verified again to be completely inert. So it has to have no effect on a human being. So we already know from years of medical research on using placebos, typically in our sugar pills, they end up, which aren't appropriate in acupuncture research, they end up having treatment effect even due to the patient manifesting the desired results. So obviously the sugar is doing nothing. This is clear, and that's verified. But applying this thinking to acupuncture studies with fake spring sham needles or actual needles being inserted in locations that aren't the intended protocol, without verifying these controls or sham treatments to be without effect, like the sugar pills, the results of the comparison between the real acupuncture and the control arm create a scenario that is far more challenging for the acupuncture to outperform the sham, because the sham could be very indeed having effect and show favorable results itself. Us just putting acupuncture points in another point in the body means nothing. I mean, there's any acupuncturist getting through school has to know where 400 to 500 different points are. So the idea that there's going to be an effect on top of the patient manifesting is the desired results is highly likely. I hope that makes sense. So bottom line, I'm just pointing out that this model of researching acupuncture is flawed, not in acupuncture's favor. So when we actually do see acupuncture improving live birth rates, we can be assured that it's doing exactly that, and probably even more so than the results are dictating. So, and finally, dose. This is probably the most important piece that I want people to understand, because we have so many people come just for a treatment or two, or just embryo transfer day. They hear that it will help, or they decide to come for treatment and they only come once here and there. They're not consistent. So dose, number of acupuncture treatments, and the consistency is so important on the clinical level. Another colleague and researcher, Lee Hollander-Rubin, concluded in her research and stated the following in regards to dose. She said, "It's my opinion that the pre- and post-embryo transfer treatments are insufficient to increase IVF birth outcomes alone, but is helpful in supporting women on the day of embryo transfer and helps to relax them and become more receptive to their embryos. However, when the 2 sessions on the day of embryo transfer are combined with a larger dose of acupuncture, similar to what we see in other studies, i.e. 9 to 12 sessions approximately prior to embryo transfer day, we see a significant association with improving IVF birth outcomes. So basically, a fundamental flaw in the research and in the clinic is dose. People just are not getting as much acupuncture as they need." So just quickly, a word on bias in research. Obviously, that is a big topic, but as with most, any meta-analysis, which is a study of studies, is what we're going to go through here. There's potential for bias within the studies that are examined, which can affect the accuracy of the results, obviously. The inclusion of large numbers of studies and subjects helps to minimize this issue, as does the absence of financial motivation in obtaining specific results. Since these meta-analyses contain significant numbers and there's no financial conflicts, there's no drug to be sold at the end or anything, the results from these studies I'll discuss are more trustworthy. And of course, they've gone through as rigorous Cochrane risk bias as they can as well. These all passed that. So the first study we're going to go through is done by Carolyn Smith et al. And her group. Acupuncture performed around the time of embryo transfer. So she did a systematic review and meta-analysis, and it was published in Reproductive Biomedicine Online in 2019. So this meta-analysis was done to evaluate the safety and effectiveness of acupuncture as an adjunct to embryo transfer when compared to controls or no adjuvant treatment. Acupuncture administered within 1 day of embryo transfer. Most include 2 treatments on the day of embryo transfer before and after the procedure. So there were 20 trials. This is key. 20 trials. Over 5,000 women were included in the review, and they were primarily done in the U.S., South America, and Europe. And so the conclusions were that there ended up being a 32% increase in pregnancy rate. So remember, this is with that low dose, 2, sometimes 3 treatments, the 2 being on the embryo transfer day. A 32% increase in pregnancy rate. So that was 12 trials, over 2,000 women. A 30% increase in live birth rates, and this is the statistic that really matters. So this was almost 2,000 women and 9 trials, and 43% reduction of miscarriage, and that was 10 trials over 2,000 women as well. So the above data is based on risk ratio and confidence interval. So you'll see the RR and the CI behind the conclusions there. And just quickly, risk ratio greater than 1 means there's an increased risk of the measured outcome, and less than 1 means there's a reduced risk of the measured outcome. So if RR is 1.3, there's a 30% increased risk of live birth rate when compared to the control. So CI meaning how confident the researchers are in the result. So if the numbers are close together, then that means a larger sample size and greater degree of accuracy of the results. Moving on to subgroup analysis. So there's significant effect on clinical pregnancy rates when used in women who had multiple previous IVF cycles. So this is important, where there was more drilled down where the success was. So women who had multiple previous IVF cycles, or where there was a low baseline pregnancy rate, including women who have poor prognosis of IVF success. And that was also confirmed by a meta-analysis in 2013 by Mannheimer. And the previous subgroups analysis had also found higher pregnancy rates from acupuncture trials administered during ovarian stimulation. So when the dose was getting higher, when women were doing their stim injections, and in an increased number of treatment sessions performed prior to and including the day of embryo transfer. So therefore, dose, again, is important to consider in future research, and particularly if you are choosing acupuncture to help with your IVF. So review done by by Hollander Rubin, Lee Hollander Rubin, a colleague again, and Anderson and Craig came to the following conclusions in a paper they titled Acupuncture and In Vitro Fertilization Research, Current and Future Directions. These points point towards strengths and weaknesses in the current literature and ideas for improving both treatment efficacy as well as research in the future. So 2 to 3 acupuncture sessions performed on or around the day of embryo transfer are insufficient interventions to improve birth outcomes with in conjunction with IVF, but provide significant IVF stress related stress reduction. We'll get to research on that. Evidence suggests several acupuncture sessions improve endometrial thickness, reduce stress, and improve patient satisfaction. Observational studies suggest more acupuncture sessions are associated with increases in clinical pregnancy and live birth rates. Again, the dose. An optimized acupuncture intervention with evidence-based guidance on number of sessions, i.e. at least 9 to 12 before embryo transfer, are needed for future studies to clarify acupuncture's role in supporting IVF cycles. Again, dose, dose, dose. And I want to always be adding consistency to that. So moving on, another study done by YINSTILL et al. Acupuncture for infertile women without undergoing assisted reproductive techniques, or ART. So a systematic review and meta-analysis published in Medicine in 2019. So studies of randomized controlled trials on women with fertility treated by acupuncture or its combined therapy were included in this meta-analysis. The experimental group received acupuncture or its combined therapy, and the control group received other standard therapies such as injected Western drugs or oral Western medications, Clomid, letrozole, etc. Control groups all included placebo. So Western medication used as controls in these studies consisted primarily of clomiphene or Clomid, metformin, HCG, and bromocriptine for high prolactin levels. 22 trials with a total of 2,591 participants were included, so all the women were 20 to 40 years of age, and all sperm samples were normal, which is important. And it is all these studies were conducted in China as well. Primary outcomes included pregnancy rate, which was confirmed by pregnancy test and ultrasound. Secondary outcomes included ovulation rate, endometrial thickness, and endocrine indexes, so hormones. Conclusions were their findings. This is what they stated. Our findings provide the clear evidence that acupuncture might be an effective intervention for infertile women without undergoing ART. So this is without having to go through the IVF. Evidence of significant effectiveness in the acupuncture group was observed in pregnancy rate, ovulation rate, LH, and endometrial thickness compared to that of the control group. In addition, subgroup analysis of different types of intervention suggests that acupuncture alone or combined with other therapies is more beneficial in terms of pregnancy rate compared to benefits of standard therapies. So we'll just go through some of these individually. The pregnancy rate increased 84% with the inclusion of acupuncture compared to control groups of just Western medicine alone. So the combination. Subgroup analysis showed that comparing with pure Western medicine intervention, no matter the intervention, acupuncture alone with acupuncture plus Western medicine, all exhibited significant improvement. So, excuse me, in the PCOS groups, they showed very significant improvement in pregnancy rates with the addition of acupuncture. Ovulation rate also showed significant improvement with the addition of acupuncture. That's 15 trials over 1,700 women. Endometrial thickness was also significantly improved with the addition of acupuncture. That's over 786 women in 9 trials. And finally, LH levels, or ovulatory hormone levels, were significantly improved with the addition of acupuncture. So LH sometimes may be a concern in the luteal phase or for ovulation, so ovulation implantation, so important there. So moving on to another study done by Carolyn Smith et al., DeLacy and Chapman. The effects of acupuncture on secondary outcomes of anxiety and quality of life for women undergoing IVF. So this is this is a randomized controlled trial that was published in Acta Obstetrics Gynecologica and in Scandinavica. So in 2019, a Scandinavian Obstetrics and Gynecology journal. So this was a double-blind randomized controlled trial where acupuncture versus sham acupuncture control. And I know we've spoken about this. So remember that these results would be even more improved if there was a proper sham. So it was done in 16 IVF centers in Australia and New Zealand, and only fresh cycles, no frozen donor or PGD cycles were used. There's over 500 participants, and they all received 3 acupuncture treatments and completed their IVF cycle. So 1 treatment during injections, like around stim day 6 to 8, and then 2 on embryo transfer day as usual, before and after the embryo transfer. All the participants were not using acupuncture prior to the study. And a special note here is that the original sample size was over 5,000, and it dropped down to 526, largely due to the fact that so many women were already using acupuncture and didn't want to risk being randomized into a non-acupuncture or sham group to do the study. So that shows you its growing popularity. Anxiety scores were taken on embryo transfer day. So the conclusions, women that received acupuncture reported reduced anxiety after embryo transfer when compared to the sham control. Okay, so the mean difference was 1.1 with a 95% confidence interval. But what's important here is the p-value is 0.03, which means that the results they obtained were significantly in showing that the acupuncture group reduced anxiety when compared to the control. Although this effect was not sustained after 14 days after embryo transfer, that's probably, two of the most stressful weeks in a woman's life. It's partly why, I'm sure. And there was no more acupuncture after transfer, and neither group said they improved quality of life. And again, that points back toward dose. In this study, so again, the p-value is where it shows that it's statistically very probable that the results are that we're showing are reality. So some considerations with this research are that anxiety and low quality of life are experienced by women during and following an IVF cycle. So acupuncture continued through the 2-week wait post-embryo transfer might be super beneficial for anxiety, and special note there that acupuncture, if done by someone who is qualified, is very safe in early implantation and pregnancy, actually quite beneficial. And increased acupuncture dose, may benefit the quality of life throughout IVF cycles, so before, during, after. So moving on, this was kind of confirmed in a study that I was involved in, which we did a comparison of stress levels in women undergoing single versus multiple acupuncture sessions. So we looked at dosage just really, really briefly prior to embryo transfer, and that was published in Fertility and Sterility. This was a retrospective cohort study, and we had 87 women that went through IVF at a private fertility clinic. All women completed a validated questionnaire that was called the Perceived Stress Scale on embryo transfer day. So women either went through 1 or more than 4 treatments in the month prior to. So it was either embryo transfer day treatment before and after, or an increased dose of 4 or more in the month prior. So for the women, stress is that received more than 1 month, more than 4 treatments of regular acupuncture before their embryo transfer, showed significantly lower stress levels on embryo transfer day. So that demonstrates the dose-dependent effect again. So bottom line, acupuncture appears to be, a promising stress-lowering tool when in women undergoing IVF. In our clinical experience, infertility-related or IVF treatment-related stress or anxiety, it might be the primary reason a physician or a nurse refers a patient for acupuncture. The psychological burden, and that's great, but the psychological burden associated with fertility can be a barrier to women continuing treatment. So if acupuncture can help reduce stress throughout the IVF process, people will end up choosing more treatment cycles or to go through IVF more times if necessary, So this will ultimately result in more babies. So acupuncture can help in live birth rates inadvertently through the emotional and patient experience, improving that experience of women going through IVF, so they are more prepared and have the courage and wherewithal to try again. So anyway, another study. This is one of my favorite studies that I've seen, as it tries to encompass the true essence of traditional Chinese medicine, which is holistic. Okay, and this was done by Lee Hollander Rubin again, and her group. It was published in Reproductive Biomedicine Online in 2015. So this was a fairly well-powered retrospective cohort study of 1,231 IVF patient records. So they were undergoing the IVF patients were undergoing. They either received acupuncture or whole systems traditional Chinese medicine, so as an adjuvant to their IVF treatment. So whole systems traditional Chinese medicine is a complex intervention that can include acupuncture, Chinese herbal medicine, dietary, lifestyle recommendations, etc., etc. This is more reflective of what we do in the clinic. We use whole systems traditional Chinese medicine. Never do we just simply have someone come in. It's if we have the time and can give the dose. Never do we just give a simple protocol to people, do acupuncture, walk in and out of a room, so this is more reflective of what we would actually do for each patient. We create a plan and we help them prepare for their IVF. So outcomes compared among the three groups. So there's just the IVF, there's IVF and acupuncture on embryo transfer day, and then there's IVF and whole systems, TCM. So the primary outcomes here were live birth. So the conclusions were overall IVF with adjuvant whole systems traditional Chinese medicine was associated with greater odds of live birth in donor and non-donor cycles. So of 1,069 non-donor cycles, so fresh IVFs, whole systems traditional Chinese medicine was associated with greater odds of live birth when compared to IVF alone, or embryo transfer with acupuncture alone as well. So in the 162 donor cycles, we saw the same. So when we're looking at adjusted odds ratio, it means if exactly 1 means that exposure to the property A does not affect the odds of property B. An odds ratio of more than 1 means that there's higher odds of property B happening with exposure to property A. So an odds ratio of less than 1 is associated with lower odds. More than 1 is associated with higher odds. So I just quick explanation of how they took those measurements and came to their conclusions of the adjusted odds ratios. So traditional Chinese medicine has a saying in one of our oldest texts, a mediocre doctor treats disease, a good doctor prevents disease, and a master doctor teaches his community to be well. And we do all of this every day on a clinical level, and helping our community to be well is hopefully something that we can do through the creation of these presentations. And so it can be passed along and help those that better understand how they can help themselves. And finally, with leaving off with the quote of a local IVF reproductive endocrinologist and IVF doctor, Dr. Jeff Roberts, the easiest method to improve the outcomes for pregnancy and child is keeping mom healthy. So a few references. Thank you for listening to my presentation of how acupuncture improves fertility treatment, success rates, and patient experience. Please reach out to us at YINSTILL.com if you ever have any questions or want to learn more about how we can help.